Namaskar. We would like to welcome you all on behalf of Independent Research Ethics Society, AYUSH Samriddhi International Webinar Series. We are creating awareness on World Polio Day, which was celebrated yesterday. Polio status and steps. This is our milestone of 2771, and I would like to welcome Dr. Sakat Kumar Basu from Canada and West Bengal and Dr. Suparna Sanyal Mukherjee from Bolpur for the event. Theme of Polio Day is Together We End Polio. So thank you speakers for the joining, and thank you YouTube viewers who will watch this episode at their convenience. So without wasting much time, I would like to request Dr. Sakat Kumar Basu. Welcome, Dr. Sakat.
Thank you, Sharma ji. It's a pleasure to be on this part, and we are all excited to meet you tomorrow. So we are looking forward to it. So getting back into the World Polio Day, I'm going to highlight the importance of the World Polio Day and a little bit on the status. And Madam will talk more in general about the polio-related problems and challenges. We splitted the project as such. So, World Polio Day, 24th October, was established by the Rotary International to commemorate the birth of John Salk, who led the first team to develop vaccine against poliomyelitis or polio. This polio vaccine discovery is one of the major monumental discovery in biological and life sciences, particularly also in medical sciences, in the sense that it changed the destiny of the world in science. That so many people who used to suffer from polio, the vaccine was discovered, and it has since then helped in eradicating polio from most part of the world. John Salk's contribution in that particular sense in transforming the lives of millions of people around the world, particularly in developed, undeveloped, underdeveloped countries, particularly where there is lack of education, awareness, sensitivity about diseases and things like that. It's very, very important that this discovery change the destiny of our the planet as a source. So one of the most monumental discovery, just like other major discoveries like penicillin, that has changed the future of our medical sciences. This is one such very, very important discovery in the field. The use of the inactivated poliovirus vaccine and subsequent widespread use of oral poliovirus vaccine developed by Albert Sabin led to establishment of the Global Polio Eradication Initiative, or GPEI, in 1988. Since then, GPEI has been able to reduce polio worldwide to the extent of 99%. Now, this is where it is very important to highlight that by this time, we should have been able to say that we have been able to eradicate polio from the world by 100%, that it is a completely eradicated disease, but it still persists in some pockets of the world and particularly vulnerable areas. And we will highlight and discuss a bit on this, but it is important to highlight that we still have a 1%, a little less than 1% impact of poliomyelitis around the world. World Polio Day is thereby an annual observation and celebration where the members of the Rotary International, along with public health advocates, enthusiasts, individuals, government initiatives makers, NGOs, all come together on a common platform to greet and welcome a polio-free world and conveying to commemorate their accomplishments in the global campaign against polio. This is very important because, as I mentioned, that this education and awareness is missing. This education and awareness needs to go in particularly those areas which are extremely vulnerable. This day also provides a platform for deliberation on the requisite measures to preliminarily eliminate polio from the face of the earth. Now, there has been so much modification of the vaccine. It has been made easily available. Now, even if we look into India, the vaccination program, I would definitely say, in spite of limitations, in spite of various challenges, had been very well established by the government. Cards are being provided and it is being monitored. But one very important thing that we need to realize that it should also come from the parents. I mean, there are some communities around the world that are very deeply religious, and because of their religious belief, they believe that's outside external biologically activated or deactivated or engineered organism should not be introduced into our body. We will leave it to expose it as nature it is, and God will take care of us. Now this is okay in case of thinking, but when it comes to practice in medical sciences, this become very, very challenging. You will be surprised to know that in very, very rare some parts of Africa and very close to our home in the remote rural tribal areas of Pakistan and Afghanistan, this polio is still thriving. Now, why it is thriving? It is thriving because whenever the health workers in that areas working from the government has been trying to reach those tribal areas to particularly provide the vaccination, they have been attacked. They have been sometimes killed, sometimes they have been abused, or even sometimes being what you call, there has been obstruction in a way that they were not able to access these tribal areas. And in many cases, kids who are born and are not vaccinated do get this infection, and they are being subjected to these kind of challenges and problem. And in a world where we have all these vaccination program, World Health Organizations are working together to eradicate, it's happening in very remote rural areas, particularly with very strong religious backgrounds or superstitions and other things. This is being prevented. The vaccination process is being prevented. Modern health workers are not being allowed to access those areas. Sometimes they're assaulted and even killed. This is dangerous in that particular sense that not many people will even like to venture to these areas. But there is not always a lack of education and awareness behind this. There has been investigations, and that has clearly indicated, particularly in the case of a country like Pakistan, where there are these children who are developing polio and are suffering from the very young age. Sometimes during the Hajj, they are being transported to Saudi Arabia and they are being used for begging purposes. And so these forced, you know, this is not just a lack of education and awareness. So there is a motivation and a money driven part, because so many people around the world are visiting the Saudi Arabia during the Hajj, and these people that are coming with disabilities, and sometimes these disabilities have been made deliberately on very poor rural communities which are uneducated, and they are being exploited for these begging purposes. Recently there has been reports that the Saudi Arabian government has taken very strong measures, and they have returned people who are coming to Saudi Arabia during these festivals as a part, or the religious rituals as a part to do the begging, and has transformed this into a legal or in more other parts an illegal business to be completely eradicated and returned to Pakistan and other countries of their origin. And they have taken a strong vigilance and are putting it an example, because if you encourage them to beg in this country, you never know how many more children or helpless families are made victims of these processes. Sometimes a part of this booty, a part of these begging alms are being provided to the impacted family, but a major part goes to big syndicates which are operating in huge significant areas, and many of this money are going to terrorist outfits or other parts, and to benefit people who are running those rackets. So it is not just only a lack of education, superstition, religious beliefs, faiths, misinterpretation, or apathy towards modern use of modern medical systems. There is a very systematic way in which some very dangerous syndicates are playing into these areas, taking and exploiting helpless families who are being exposed to polio, and then utilizing them for being extracting begging alms during those festivities and stuff in other countries and stuff. This could not be done by ordinary poor uneducated people. There has to be very sophisticated educated people chain who are operating along in this and exploiting these people. And in many parts of Pakistan and Afghanistan, as you can well understand, that because there is no rule of the land, complete lack of failure of the governments in procuring and providing facilities to the common people, educating and awareing them, and more or less that in tribal areas there are no significant presence of the government. They have their own rules, laws, regulations, and even the military as well as the police fear to even visit those areas. They are so threatening and deadly and dangerous. But because of this, polio has still existed in some pockets, unfortunately, and it is continuing to survive in this and thrive in these areas, although smaller in number. But this is something that the world needs to take over and understand how both religion as well as superstition as well as syndicates which are operating in these areas are utilizing infected children as a part of their money making machinery. So these being unfortunate, we must say that there has been extensive work being done in education and awareness, but there has to be this environment where people can work, where health workers are being attacked, where health workers are being threatened, where the health workers are being humiliated and harassed. It is impossible for them without any weapon and stuff to go in areas and provide their services. So some governments in some countries have failed to the result that even basic medical health care, particularly urgent health care such or basic health care such as vaccination of the children, are could not be operated successfully or without fear, so that we could have a longer healthy life in that particular extent and sense. So with this, our World Polio Day becomes even more significant in the sense that while we have been victorious around the world, we still need to work, we still need to persist, have patience, continuously work towards building education, awareness, building a rapport in those areas where modern treatments are being rejected, to slowly infiltrate those communities so that we can help them with the benefits of modern medication, vaccination, etc., so that it is provided. And the government needs to work in close association with foreign governments to understand that how these syndicates are operating and to completely prevent them from exploiting poor people and utilizing this as a resource for prevention of proper healthcare and treatment in these areas. So these being very important, we need to think about and work towards developing strategies and program, particularly under World Health Organization and Global Polio Eradication Initiative, to work very close together so that we can join hands in making the world a polio free place. A polio free platform is essential, and there should not be left any vacant packet, because then we allow a breeding ground of the germs to breed, and then slowly, you never know, it may spread out, and still in one regional areas it can impact the life of people and stuff. So this is very important observation, and we need to work together on common platforms, solidarity with other governments as well as international platforms to help these countries to work together in getting rid of polio. So thank you, Sharma ji. It's once again a been very pleasure. I will take a minute and I will try and see if madam has been able to connect. If not, I will try to get her connected. Allow me 2 minutes. Okay. Sharma ji.
Okay, okay.
Okay. I'm just trying to connect her. Thank you so much. Sharma ji, in 1 or 2 minutes, she's joining. Please allow 2 minutes. I just talked to her over phone.
Welcome, Dr. Suparna Sanyal Mukherjee, Madam. I would like to request you to kindly bless the platform with your blessings on the polio. Thank you. Welcome.
Thank you very much. Thank you for giving me another opportunity to say something on this auspicious topic like the polio eradication. Really, it is a very good and interesting topic right at this moment. And we are leading the polio free world. It is fact that we have enriched the polio free world, but still there is some effect and some continuation is going on. It is beyond our knowledge, but we have reached the polio free world. Polio is a not very dreaded disease, but it is a disease which may happen anytime in any case or any child. Basically, the polio vaccination was when it was started, and WHO taking the bold part for giving the polio-free world, just because the person is with the polio is facing. There are so many problems like socio-cultural problem, socio-economic problem, socio-religious problem, and the health problem and health hazard. It is a very disputed situation, the person, those who are suffering from polio. It may happen in case of this childhood and neonatal stage when it is a very dreaded and very dangerous disease for the children, those who are suffering from this polio. And polio is may happen. It is also the genetic cause, and this genetic cause is also happening in case of the non-disjunction, which is happening in the mother womb. So, if the taking care of from the gene taste and gene manipulation and gene counseling is also going to be arrested this disease by the root level. And when it is also the vaccination system has started, and when the child in the neonatal stage in the mother room, when it is happening, this polio caring and polio vaccination started, from that time it is very good result we are getting. The now the present generation, but the children is born without polio. So it is our pride moment that we have eradicated polio and we had restricted polio from our next generation. And next generation, when they are not suffering from this any kind of polio, but when they are suffering from, I know one of my friend, which is a polio, she couldn't go, she couldn't move anywhere. But now it is also boosting for that. Though she has the lake was polio lake, and she has wear this shoe, like the artificial shoe, and she can walk, she can run, she can move, and she can do every work. And she's working in this ONGC and a very high position. Also, this physically handicapped quotas she has appeared. But we have seen the paramedical sports where the polio patients are also taking part in the the 100 meter, 1000 meter, then 200 meter, 500 meter race. And there the Paralympic, it is also a very renowned sports. And those person, those who are suffering from the polio, they are taking part, and they are also incorporating, and they have taken this through this artificial intelligence, this the lakes, they have taken the lakes, and they are running. It's so good and so interesting sports we have observed when the Olympic used to be happened, and when the Olympics started. And if you can observe it, you will astonish that there are so polio person, they have the so mental stability, and they can go up to the they are climbing the mountain, they can run, they can move, they can swim, they can jump, they can take part in the discus, then the high jump, long jump. It is a miraculous situation they have done with this the polio. But it is though they are having the new technology, new modification, giving the polio free, morphologically they can change the pattern of life, sustainability when they are taking part in the any kind of of jobs, any kind of sports, any kind of medical aspects, because the other parts is very active. The brain functioning is very active. They can taking part in the every aspects of the life. But when they are suffering from this polio, only the mental illness. That means they are not taking care of their friends. They are not at part with their friends. They are not doing the as the friends are doing. So these are the mental situation. The behavior was little bit was stooped down, but nowadays it is after having introducing this artificial intelligence and this the taking care of this the polio vaccination, we have restored the polio from the eradication, and we have restored the polio suffering baby by taking birth of the polio suffering baby, with polio baby, we have restricted. So it is our very pride moment that we have reached the polio free world. At the same time, the Ayush also taking care of, though the we can lifestyle we can change and we can habituate it, and we can taking part in the Ayush medicines and Ayush system and Ayush generation. So there should not be any kind of polio, because if we can look back to our forefathers and the our ancestors, there is no polio, because they are taking they are medicated from their life sustainability, from the life system, and they are also very close to the nature, and they are practicing Ayurveda. And especially it is a very noticeable point, and it should be noted and observed that the tribes, especially those who are living deep inside the forest, and the indigenous people, they know the indigenous technology, but they are not suffering any kind of polio, because there is no system of vaccination. They couldn't go to the healthcare, local healthcare health center. They couldn't get any kinds of healthcare, but their rituals, their system, their customs, their rights, everything is so many nature oriented, and they are practicing, they are taking with the herbal medicine, so they are not suffering any kind of non-disjunction, neither any kind of polio, nor any kind of the discrepancies, not any kind of the any kind of ailment, the genetic disorder. So it is a very interesting point. If we can introduce Ayush in each and every parts of our life, we can live the free world. Because nowadays the oxygen level of the air is deteriorating, though we are surviving 16.78% of the oxygen level in the atmosphere. But if it is 1% deteriorate, then only we can also suffer from any kinds of breathing trouble, any kinds of diseases, COPD, etc., etc. So this is our time to think over. So how we can restore our life sustainability, and how we can restore our life expectancy too with this Ayush. Thank you very much. Thanks for giving me such an opportunity. Thanks a lot.
Thank you very much, madam. I am waiting for tomorrow